Hi everyone, I'm Sarah Wright, Director of Communications for the Colorado Foundation for Universal Healthcare. Thank you so much for supporting our mission, which is simple, guaranteed, quality healthcare for all for life. And the need for everyone to have healthcare that they can count on and afford has never been more urgent. To speak to that urgency, I'd like to welcome Madeline Jacobs, MD, to speak. Maddie retired from her rural family practice when she realized that reforming our broken healthcare system was the best thing she could do to help her patients. She works long hours leading her local Health for All group in Canyon City, Colorado, and making a difference for the cause, one conversation at a time. Maddie, welcome.
Thank you very much, and welcome to everybody. The crisis in healthcare in America has been evolving over many years and is now magnified by the pandemic. People with treatable disease are dying because the system is run for profit, the profit of the few, not healthcare of all. And the social inequities of our society are increasingly stark. I was moved to work for universal healthcare by the increasing tragedies I was seeing in my practice. In the last year of my practice, 3 asthmatics ended up on ventilators because they could not afford their medications. 3 people who hadn't reached the age of 65 died from colon cancer because they could not afford colonoscopies. A friend lost her vision from hypertension when she couldn't afford to see a doctor despite working 3 jobs. Providers too have been suffering with the increasing corruption of our healthcare system. In 2018, a report showed that physicians have a higher suicide rate than combat veterans, and the moral injury and PTSD caused by our system have only accelerated. The world, with the sorry exception of the United States, the richest country in the world, has shown that single-payer universal health care saves money, covers everyone, and has better health outcomes than any other system. People are covered from cradle to grave. For that reason, I am devoting my time working to implement such a system here, where the goal of the healthcare system is to promote health, not profit. I'm turning 65 and now qualify for Medicare. Gone is the $1,000 per month premium, the $8,050 deductible, the co-pays, co-insurance, and provider networks. Why is it that hardworking Americans must wait until they reach 65 to access healthcare? Why do we tolerate people losing their jobs due to cancer and then their health care when they most need it? With the pandemic, we are seeing the insanity of job-dependent healthcare in action. Why is healthcare tied to employment, burdening patients as well as their employers with the cost of profit-motivated health insurance, whose goal is to deny care and so maximize profit? Why are the costs so much less for our highest risk population, the elderly and the disabled who are on Medicare, than for everyone else? The answer is clear. The powers that be have decided that profit for insurance, hospital, and pharmaceutical corporations is more important than the health and well-being of human beings. We must ask ourselves if this is the choice that aligns with our moral values. The Colorado Foundation for Universal Healthcare is working for a single-payer universal healthcare however we can get it. Canada got theirs when Saskatchewan adopted it and the rest of the country saw how wonderful it was. Taiwan, as a nation, got it through the forward-looking vision of its conservative government. The volunteers of this organization are working hard to make single-payer universal healthcare a reality here in the United States. It's time we caught up with the myriad countries that have already made the moral decision to provide healthcare for all their people. Thank you, and I hope you can help us.
Thank you so much for that heartfelt speech and for all the hours you give to this cause. And this occasion is that tomorrow is Colorado Gives Day, and we're asking everyone to go to ColoradoGives.org to the Colorado Foundation for Universal Healthcare and schedule a donation for tomorrow. Colorado Gives is a wonderful event that has been in effect since 2007, and it's to help Colorado nonprofits specifically. And it's the Community First Foundation and First Bank co-partner. And so the So there are matching funds available. So if you would schedule your donation today for tomorrow, Colorado Gives Day, it will help us continue our work for simple, guaranteed quality healthcare for all for life. We appreciate you so much. And our next person, our next guest is another amazing volunteer, and her name is Nancy Reed. And she was trained as a physician assistant and lawyer, and she's very passionate about everyone having health care, which is why she dedicates so many hours as a strategy team member for the foundation. And prior to volunteering for us, Nancy was a founding member of the board of the Chaffee County People's Clinic, which provided healthcare services in Salida and Buena Vista for people who are low income and without insurance. Nancy, welcome.
Thank you so much, Sarah. Well, the work of the Colorado Foundation for Universal Healthcare values our lives, our choices, and our dignity. That is why I give my time and my financial support to this effort that truly lies on the right side of history. During World War II, health insurance, which had not been widely available, became an employee benefit covering many Americans who are young, healthy, and lucky enough to be employed by these companies. Those who were retired or who were not able to work did not have this benefit. Insurance offered outside of employment had exclusions for many pre-existing conditions, and it could cost too much for people to get adequate care, leaving them to suffer and die in poverty. Companies were not interested in covering those 65 and over. They wanted a healthier pool of people where they could make the most money. The less they spent on healthcare, the more they profited. Our country recognized that those 65 and older were vulnerable and in need of guaranteed quality health care. So we adopted Medicare. That's who we are, and that's what we did. Insurance companies were not distressed by Medicare. In fact, they created the conditions that left out older and sicker patients. And even though Medicare serves those needing the costliest medical care, it has been a great success for 55 years. This is because administrative costs are low and there are no middlemen and profits draining off healthcare dollars. People celebrate when they turn 65, just like Dr. Maddie. Coverage is simplified, continuous, and medical bills are paid. Medicare has higher patient satisfaction than employee-sponsored insurance. It has proven effective, efficient, and popular. In the years since Medicare's birth, insurance companies have expanded their efforts to avoid and deny to many more Americans the care they need. They do this by increasing their profits, by devising obstacles to care, higher and higher premiums and deductibles, restrictions on benefits and providers, extensive pre-authorization requirements, and fear-inducing bills. We all have only one precious life. We must prevent unnecessary suffering and not allow corporations to use disease and injury to maximize their profits. We believe healthcare dollars should go for healthcare. And as Maddie was saying, access to healthcare is more critical than ever, with millions losing their jobs and their employer-sponsored insurance, and millions more losing jobs that never provided insurance. And yet, there are still millions, essential workers, and those who must work outside their homes in the middle of a pandemic who don't have access to the care they need. Connecting healthcare to employment has been shamefully inadequate, unreliable, and terribly flawed. I volunteer with and support the Colorado Foundation for Universal Healthcare because we fight for healthcare where everyone can trust that they will receive all the medically necessary care they need, has high quality care that will continue without interruption, can see the providers and go to the hospital they choose, making decisions directly with their providers, live without fear of falling into poverty, suffering, or dying needlessly. where everyone has healthcare that values their lives, their choices, and their dignity. Today, not just people 65 and older, but most of us have become vulnerable and need guaranteed quality healthcare. So let's be on the right side of history and expand and improve Medicare to cover everyone. Then we can all celebrate. Please join our efforts. Thank you.
Thank you so much, Nancy. That was wonderful. And again, this is a special program because tomorrow is Colorado Gives Day, and we'd love for you to go to ColoradoGives.org and find the Colorado Foundation for Universal Healthcare. The link is in the chat below this Facebook Live, and schedule your donation for tomorrow, December 8th, to the Colorado Foundation for Universal Healthcare. Thank you so much.
Hi, I'm Patricia Rice. I'm the social media director for the Colorado Foundation for Universal Healthcare. And I want to introduce Elaine Branchard. Elaine is a retired nurse. She worked most of her career caring for young families as they welcome new babies into the world. She's seen healthcare move towards a more private, for-profit model, and she wants to change it. She spent hundreds of hours, I would guess, on collecting signatures for the Colorado Care Yes campaign, which would have brought a universal healthcare system to the state of Colorado. Elaine believes that we need a universal healthcare system, and she wants to talk about what would it be like if we had a universal healthcare system, improve Medicare for all in our state and in our nation. Imagine. Elaine?
Hello, I am a volunteer with the Colorado Foundation for Universal Healthcare, working to bring a universal single-payer healthcare system to residents of our country, either on the Colorado level or ultimately at the entire US level. When considering why I spend hours every week reaching out to share the organization's message with others, the reason for me is pretty simple. I imagine my children and grandchildren living in a country where seeing a doctor when they need it isn't an issue at all. An Australian friend shared in a recent panel discussion that his family, when he was growing up, really did not give much thought to seeking healthcare when they needed it. They simply sought out a medical provider. Be aware that the US is the only developed country in the world that doesn't have a system of healthcare that covers all their people. I imagine they live in a country where their choice of careers isn't dependent on the whims of an employer-sponsored healthcare plan. If the interests of Dana and Chris lead them to starting a small business or even a large business, they can do that. A business owner doesn't have to shop every year for policies to be competitive in hiring workers. If Quinn's talents lead him to teaching acting to children, and Emma's passions for horses leads her to teaching equine skills to children with disabilities, they can do that. Facilities offering services to children are likely to be not-for-profit and unlikely to provide healthcare coverage. If Sarah's dream has always been to be an educator in a public school system, she can take that position and have health coverage for her entire family. In all those cases, there are additional benefits. In a publicly funded system, the savings are significant. The costs are less, and everyone from cradle to grave receives health care. I imagine my children and grandchildren living in a more caring, less stressful culture, where the benefits of a universal single-payer system of healthcare financing are available to everyone. Volunteering and supporting the work of the foundation and achieving universal single-payer healthcare will, I know, result in the life for them that I can imagine. Thank you.
Thank you, Elaine. That was absolutely wonderful. We all should imagine what we could do if we had a single payer, improved Medicare for all healthcare system. I wanted to also mention that Elaine is one of our super volunteers like Maddie, Nancy, and Bill. And without her, we wouldn't be half the organization we are now. Next, I'd like to introduce Bill Semple. Bill Semple is the president of the board of the Colorado Foundation for Universal Healthcare. But even more, he's a person who has, as a licensed clinical social worker, treated clients for more than 30 years. And he worked in both private practice and for community health organizations. And it gave him a unique understanding of how our system doesn't work. Bill's experience as a social worker working in community health and private practice gave him a profound appreciation for the inherent gaps, inequities, and inefficiencies in how we pay for healthcare. And he's seen firsthand the many ways people have fallen through the cracks. Bill?
Thank you much, Patricia. So I'd like to say a few words to ask for your support for the Colorado Foundation for Universal Healthcare on Colorado Gives Day. And the realities are that how we pay for our healthcare bakes injustice into the workings of our daily lives. How we pay for our healthcare is central to ongoing racial inequities and related economic inequality. Paying for needed healthcare drives 6 to 8 million Americans into poverty each year. The current pandemic has had at least twice the impact on Blacks, Indigenous, and people of color, continuing the ongoing poor care these folks have received. At the same time, insurance, drug, and big hospital corporations are motivated first and foremost to vacuum up wealth from the many of us and put it in the hands of a few. We can do much better. We can spend less on healthcare, cover everyone, and have better healthcare. The mostly private delivery of publicly funded healthcare gets us there. Basically, this is improved Medicare for all. And we know that being eligible for Medicare at age 65 is a great equalizer for health outcomes. The majority of us now want improved Medicare for all. And this is why the Colorado Foundation for Universal Healthcare is joining a coalition with a number of grassroots organizations around Colorado to push to pass the Healthcare Emergency Guarantee Act. This act would cover all out-of-pocket expenses for those with insurance, as well as all the medical expenses for those without any coverage, until we have a safe vaccine that's widely available. Big medicine funds the elections of many of our politicians. So it's up to us, it's up to the grassroots who are rising up to demand the way to pay for our healthcare that most of us want. The Colorado Foundation for Universal Healthcare is positioned to be the resource for a wide range of groups that are working to create a more just society. We are a lean and mostly volunteer organization, but we do need funds to fuel our efforts. Please dig as deeply as you can to support our flexing our grassroots muscles to shape the kind of state and country in which we all want to live. Thank you.
Oh, Bill, thank you. That was wonderful. I also wanted to say that tomorrow is Colorado Gives Day, and we'll be posting a link to our donation page on our Facebook post. Sarah, you want to wind it up?
Thank you, Patricia. Yes, thanks to our amazing volunteers for being willing to share their stories today to help all those who may not even have time to volunteer because they're working 3 jobs, trying to keep food on the table and survive. We are working for all Americans to have a fair and an equal shot at having the health that we need, so that together we can be stronger and healthier together. So please do go to ColoradoGives.org, follow the link at the end of the Facebook here. And you can also just look us up on Colorado Gives Day. We're the Colorado Foundation for Universal Healthcare. We appreciate you so much and we wish you well, and thank you for listening.
Thank you.